Hi, thank you for listening today. I'm Sasha, and I'm here today with Dr. Eric Luria, who's going to talk with you about some of the new testing that's available in terms of decreasing people from having heart attacks. So here's Dr. Luria.
It is amazing that a third of the population is at risk for significant heart disease, and in fact, it will be their ultimate cause of death. Did you know that 50% of people show up in the emergency room for the very first time having chest pain that turns out to be a heart attack, and they had a normal LDL and had no idea that they were at risk?
Well, it's really freaky. That's pretty scary that that's the case. Is there ways of preventing that from happening?
Well, first we need to identify who is it that we need to be concerned about. And if you're already 50 or older, and particularly if someone in your family is being treated for heart disease and you have an elevated cholesterol, you certainly have a lot of increased risk. And just other people who are at risk that have a family history for stroke, or if you have diabetes, or if you're significantly overweight. Of course, you know what the basics are for staying healthy. We all know that controlling weight and not smoking, of course, getting exercise and controlling other conditions such as your cholesterol, blood pressure, diabetes is going to lead to a better outcome no matter what else we have to do.
Are there other things that you can do to sort of prevent yourself from showing up at the hospital?
I think the main thing that we're working on now is doing some advanced testing that can help you determine if you're at definite increased risk and perhaps treat you. Even if you're being treated, you might not have adequate treatment. What's good about this is that almost all insurance companies pay in full for this kind of testing. A lot of times we think very simply that it's just we want to have a lot of good HDL, which is the good kind, and we don't want to have much LDL, which is the bad kind. But just measuring the traditional LDL, the way we've done for years, doesn't paint the whole picture. Sometimes we think of LDL as being a number, but it turns out that we can actually look at the LDL in a different way. For example, if you take 100 people and put them in 100 cars, they're going to create way more congestion than the same number of people put into 10 buses.
So you're saying those LDL particles are like the number of people and that you can sort of have them in fewer places?
Well, by putting more of the LDL in one vehicle, which reduces the number of vehicles, it also reduces the number of particles on the roadway, which then leads to much less damage to the roadway and much less likely to have an accident. And you can think of it in the same way that your blood vessels are less likely to be damaged.
So that mean that you're less likely to have a heart attack then?
Correct. If you reduce the congestion by reducing the particle number, you markedly reduce your chance of getting a heart attack or plugging up your arteries.
So is that what this new test helps you do?
That's correct. This new test provides a way of measuring the LDL by measuring particles instead of just measuring the regular LDL number.
So if you're interested in learning more about this, I encourage you to talk with Dr. Luria or Catherine Luria, ARNP. They're both very experienced. They've been practicing medicine in Gig Harbor for the last 30 years. And they offer consultations on how to reduce your risk of heart disease. And both of them have attended some very advanced training on this specific testing, including week-long trainings on it, and are some of the only people in Gig Harbor that have received this training. And I encourage you to call them for a consultation and to help you stay out of your hospital and enjoy time with your family for much longer. So go ahead, and there's the phone number to call Harbor Family Health.